The average amount spent a day on healthcare is $2,883. Although most people might have some sort of health insurance, there's about 32 million people living in the US still paying out of pocket, according to Debt.org by Maureen Milken, a columnist who writes about finance, banking, and other related topics for the past 30 years. As college students, we are beginning a new chapter in our life and trying to be more independent by maybe paying our bills, but it's likely we have started jobs that don't usually offer medical coverage. This means we are paying for doctor's appointments, dentist appointments, and even medical bills out of pocket. And these expensive bills can put a big dent into our savings and possibly even put us into debt. But healthcare is a necessity. All people should have access to a wide variety of quality health services when they need them, where they need them, without financial hardship. This is why we need universal healthcare, so all people are covered medically for any emergency or medical need they have. And the US is only 8% away from actually having universal healthcare, according to the Census Bureau by Catherine Kaiser Starkey, Lisa M. Bunch, and Rachel A. Lindstorm, 3 PhD economists and researchers for the US Census Bureau. Universal healthcare has many benefits, including curing the chronic disease epidemic and even the non-communicable chronic disease epidemic, according to Zachary Y. Kerr and Lee Stoner from the Department of Exercise and Sports Science of the University of North Carolina, as well as Gabriel Zeef and Justin B. Moore from the Department of Implementation Science of Wake Forest School of Medicine. What this means is that it's possible for all diseases to be reduced. So those with chronic disease will get the medical care they need, so they're not able to spread it to other people, and therefore eventually the disease will die down. And those with non-communicable chronic disease like cardiovascular disease or even type 2 diabetes have a chance at early prevention. They can prevent their disease from getting any worse and possibly even curing it. So the point I hear most against universal healthcare is the cost. Where would we get the money from, and would it come from our taxes? The answer is yes. Universal healthcare would primarily be paid through taxes. And if you're wondering by how much, Emily Hoven, a reporter from Cal Matters, would tell you it depends on your salary. She wrote about a past bill issued in California that granted healthcare for all. And in this report, she states that progressive income tax starting at 0.5% would be issued for those Californians making more than $150,000 annually. And this rate can go up to 2.5% for people making about $2.5 million annually. This tax would completely depend on your income. So if you're making more or less, that's where your tax would go. And I also like to note that California is likely to have the most expensive tax since our healthcare is the most expensive. So in other states, it's likely that it would be less. This rate would also depend on inflation. It's not a set rate. Lastly, universal healthcare actually improves our economy and possibly even reduce our budget. According to the Council of Economic Advisors, they conducted a comprehensive analysis on economic impacts and the economic impacts of a healthcare reform. And in this report, they find that if everyone has medical insurance, then a reduction in disability can be issued, and therefore an increase in labor supply, and an increase in labor supply and a reduction in budget would improve the GDP, which is good for the economy. Not only would more labor be available, but jobs would increase for medical staff. According to John Nicholas, a liberal and progressive journalist and author, writes in a piece today that expanding medical coverage would create over 2.6 million jobs, and this would improve the economy by increasing business and public revenue. Universal healthcare is medical coverage for all people, anytime and anywhere. The U.S. is only 8% away of the population from having it. Although each reform has its challenges, the benefits that universal healthcare could provide is worth working for. Yes, costs will increase, but it won't put anyone into debt like paying out of pocket for medical bills does. You'll have access to all the medical needs you and your family need. And once everyone has health coverage, this could lead to a healthy economy. There will be less spread of diseases, and it could improve the GDP as well. Universal healthcare is necessary to help all people have access to all the medical cares they need, when and where they need them, without financial hardship. Thank you.